Thank you for the opportunity to present. One conflict to disclose is that Bristol Myers helped to do they funded the immunohistochemistry for the PDL1 portion. So this was done using their PharmDX assay, or rather DACO's PharmDX assay. So myeloid-derived suppressor cells produce reactive nitrogen species, reactive oxygen species. They produce arginase, and all of these essentially inhibit the immune milieu when antigen presentation is critical, really most critical. So MDSCs cause direct nitrosylation of the TCR. They inhibit class 2 expression, and they also, essentially they upregulate Tregs. So no one's really looked yet at nitrosylation in lung tumors. No one's looked at iNOS expression to see whether it correlates with survival. So our goal was to see whether these MDSC biomarkers correlated with time to progression and overall survival in lung cancer. So actually, I found 4 large TMAs and went back to this TMA set from the last 10 years. And we stained it for a variety of different immune checkpoints. So here's the sample population. None of these patients received prior immune therapy. Their overall survival was essentially consistent with resected lung cancer. And the breakdown was primarily adenocarcinoma, although there was a subset of other types of cancer mixed in there. What I was particularly interested in looking at also was whether there was a higher amount of immune markers in the soft tissue metastasis versus brain metastasis. And even though these patients, we did sequence their tumors for EGFR, KRAS, and the common driver mutations, almost none of them actually received EGFR TKI. So what results did I find? So there's actually a higher expression of CD3 positive T cells in tumor tissue compared to normal tissue. This is expected. Found that there was actually a higher amount of TIL in soft tissue compared to brain metastasis. And also there was a higher amount of CD3 in the primary tumors compared to brain metastasis as well. Granted, these are smaller numbers. We're talking about comparing, I think it was about 40 brain metastasis compared to 400 primary tumors, but still intriguing result. And there was a lower amount of PDL1 both by mRNA expression and also by IHC in bronchoalveolar compared to squamous carcinoma and adenocarcinoma. So disappointing result is that nitrotyrosine really didn't correlate with any of these sites. So then I went ahead and looked at the PDL1 expression in the different types of oncogene addicted lung cancers. And this goes along with the entire story of smoking related cancers tend to have more inflammatory milieu, and they certainly tend to have more PDL1 expression. Again, this is looking at PDL1 staining of the tumor cells using the DACO 28-8 epitope IHC antibody, the one that's currently approved for Opdivo. And this was read actually by a mosaic pathologist independently. So not statistically significant, but just almost not significant. It was the EGFR mutants had significantly less, both by mRNA expression and also by IHC. KRAS had substantially more, but of course P53 had much more, and we can think of P53 essentially as being a surrogate for mutational load. Then overall survival and time to progression. Well, this is not a new story that TIL, of course, higher amount of TIL correlates with better survival. Interestingly, looking at CD3 positive cells, just all comers, they also had better overall survival, better time to progression. This ran a little bit counter to my original hypothesis that, these myeloid-derived suppressor cells would have a better survival, but, forgive me, a worse survival, but a lot of this might not actually be MDSCs that I'm looking at here. And then, again, a little bit counter to my hypothesis that iNOS would actually have worse survival. It actually had better survival. And again, there might be some confounding here with the inflammatory milieu. So again, the inflamed phenotype had better survival outcome. None of these patients were treated with immune checkpoint inhibitors. This was before that era. And P53 was definitely associated with PD-L1 RNA and protein. And so we're currently actually have done immunos on a lot more, with a lot more proteins, and just need to get them scored. Thank you.
So Ben, smoking status, PD-L1 expression.
Yes, so I looked at that actually. I looked at it as a continuous variable using pack years. And using 5 pack years as a cutoff, there was certainly a statistically significant difference in PD-L1 expression. What was disappointing was that it wasn't, treating it as a continuous variable, it really wasn't significant. I was hoping that the 100 pack year people would have more PD-L1 than the 30 pack year people, but it wasn't quite the case, even by mRNA expression.
Other questions?